such a mess. If I was to run a business, how they run the UK, I think he means the NHS, I would be bankrupt, he says.
Well, let's talk to Niall Dickson, who's Chief Executive of the NHS Confederation. Good morning.
Good morning.
We've heard from a young doctor this morning who said that her workload as a GP is just unmanageable. The NHS just doesn't seem to be able to cope.
I think that's quite right, and I think quite a lot of frontline staff feel under enormous pressure, and general practice in particular over the last decade I think has come under enormous pressure from patient expectations, from underfunding, and from lack of individuals coming forward to become GPs. So yes, these are all really serious challenges. I would challenge the suggestion that all this is because it's not run properly, as it were. That the health service has, over the last 10 years, suffered the most difficult funding settlements in the whole of its history. For 10 years, it's had almost no significant increase on top of inflation, and has had to cope with unprecedented additional demand. And no business, however efficient you are, can just keep doing that. In fact, the levels of productivity of the NHS, as acknowledged by the Treasury, have far exceeded that of the economy as a whole. So
we've heard from Sir Michael Fallon this morning talking about the £20 billion announced by Theresa May. Do you think that's sufficient?
Well, the short answer is no. We think that it does need more than that. But having said that, of course, we welcome it. We recognise that there is a degree of political courage for a Conservative government to commit to significant additional money for the health service over the next 5 years, when they would judge that the economy is in quite a difficult and uncertain position. So we recognise that. But we first of all think there's been no announcement about our sister service, social care. And unless you invest in social care, the health service itself will continue to struggle. So we've yet to hear what they're going to do about social care. But slightly worryingly, the Chancellor said, well, the cupboard's now bare because we've given the money to the health service.
And briefly, do we have to accept then that some services just won't be able to remain free?
I'm not sure about that, but I do think we've got to make some very difficult choices. So, for example, the government now has to decide, hopefully in consultation with all of us, both those who use the service, patients and the wider public, and those who work in the service, about what is going to be in their plan for the next 10 years, which will go alongside this funding. And I think that plan has to be honest and say there may be things that we can't do or will not be able to do. For example, how quickly will we be able to cut waiting lists and waiting times? I mean, you could put all the new money into that, but if we do that, we won't put the money into the community services, not least into the GPs, and try to expand their numbers or bring in new kinds of staff to support GPs to make that GP's life more tolerable, and importantly, give a better service in the community, which can prevent people ending up in hospital. And that's the trouble. We put too much money, in a way that any money we have had to prop up the hospital system, and we've done far too little in the community and in social care to try and stop people from getting into hospital in the first place.
Thanks very much. That's Niall Dickson from the NHS Confederation, which represents NHS trust bosses.